All right, today on the Franklin Community High School Career Exploration Project, we have with us the Director of Strategic Accounts for Merck Pharmaceuticals. We have with us Robert Baldridge. Robert, how are you?
I'm good, thanks.
Good, thank you. Thank you for joining us. So I guess first of all, just kind of tell us about your current role, what you do, where you do it. I know you've got a pretty big area that you cover, and then any jobs you may have had in the past.
Yep. So my current title is Director of Strategic Accounts, and I work for Merck Pharmaceuticals in their oncology division. So my customers are large cancer centers and academic institutions like Indiana University, University of Michigan, Northwestern, and I cover Indiana, Michigan, and Illinois. And my role is really to connect with the leaders in the cancer center to make sure, one, that they appreciate and understand the value of the products that we have to treat cancer, that there are no restrictions or obstacles in the way of a physician choosing to use one of our products. So essentially, it's a sales job, but yet my customers are the administrators or the leaders of the cancer center that are trying to decide which drugs we have available and what we need to do to make sure they're used appropriately, and that they can also get reimbursed when they use our product. So we have a sales team that calls on the physicians and nurses and other folks within the cancer center. And then I'm a little bit higher up in my discussion level. I talk about the value of the product, why one might be different than another in the same therapeutic area, our product versus maybe another product, to help them see, well, maybe it's easier to administer our product. It only takes 20 minutes of the time of their staff versus an hour for another one, and what that means financially. So in my role, I have a couple skill sets that are important. The first one is you have to have good people skills. So you have to be able to listen when you talk to your customer and really understand what's important to them. So I was a sales rep to start, and I called on doctors in primary care and in psychiatry about products that Lilly had back then. And it was really understanding what type of patients they saw, what some of the challenges they had in treating different diseases that those patients had, and how my product might be able to help them. Right. So it's listen to what's important to the customer and see if what you have available aligns with or matches up with what their challenges are. So that's number one, good people skills, good listening skills. Number two, you have to have the capability or capacity to learn scientific information. I was not the smartest science student in high school or college. My worst grades in college were in science classes. But I had the ability to learn, and when I needed to, could learn just enough to sound like I knew what I was talking about. And so sometimes my knowledge is only about an inch or two deep, but I can converse with my customers about the specific cancer types or diseases that their patients had. The other piece is you need to be able to understand how the science aligns with the practical treatment of patients. And you only get that by experience in talking to your customers about the particular disease or tumor that the patient might have, and understanding how our product helps a patient, helps the doctor and his staff treat the patient. So you have to have good listening ear, knowledge and ability to learn, but good people skills so you can really understand what is important to your customer.
So you're basically a pharmacist.
I wouldn't go that far because they're a lot smarter than I am.
You're a pharmacist who can sell stuff. That's what. No,
I like to say I'm a business guy who can learn enough science to sell stuff.
There you go. There you go. No, it is interesting. I mean, it's the amount of knowledge that you probably have to have about the medicine, not only the medicine, what it does, but you have to know what it's going to do to a patient, but you also have to know like what the patient is going through. So let's say, I mean, it's cancer. You have to know something about that cancer as well. So it's a ton of information you have to know.
It is, and I sometimes feel a little overwhelmed because in cancer right now, they are finding that certain drugs, like Merck has a product called Keytruda, which is approved for use in like 24 different tumor types. So I need to appreciate and understand every single one of those different tumor types. So when we say tumor types, lung cancer, colon cancer, breast cancer, cancer of the liver, cancer of the ovaries, just keep naming them off. And you can see that you have to know enough about that particular type of disease to know how your drug works to help a patient with that particular type of cancer. And then you have to work with different people within the cancer center who focus on that specific type of tumor. Yeah. So the more indications your product gets, the broader your list of customers and the more people you have to work with and understand and appreciate what's important to them.
Yeah, that's crazy. I mean, I can't imagine. I'm sure it is somewhat overwhelming for someone who struggled in science. And you're like, oh man, this is what have I got into?
Yep.
What are some of the roles that you've had in the past to get you up to this, and kind of talk about your education or that you've had as well?
Yep. So I started with Lilly as a sales rep back 30 years ago, and back then, for a number of years, they only hired pharmacists. And then for about 5 years before me, they started to open it up to people with maybe business degrees or other degrees, but that have a capacity to learn and demonstrate that they could learn the scientific side. So I was in that first window of people that they said, well, you don't have to be a pharmacist, but you have to at least be smart enough to learn what we teach you. So back then you had to have a 3.5 GPA in college you had to have a 3.5 if you're a business major or 3.2 if you're a pharmacist to be looked at and hired by Lilly as a salesperson. So that would demonstrate to your company that you have the ability to learn. You may not be the smartest scientist on the planet, but you can learn the information you need to learn. And then I had my first boss said the most important skill I had was developed in my ability to handle rejection every single day. When you're a salesperson, that's what you get. Even when you're talking to scientific leaders like doctors and nurses, you have to be able to recognize they've got to see the next patient who's in the exam room waiting to see them. And so you have to be sensitive enough to know, well, man, the information I have is really important. I need to share with you. So what if that patient is a patient that has a disease that my drug will treat? But you also have to be sensitive enough to know that patient or that doctor may have to be getting some very difficult news, and you need to let the doctor focus on that. So you could go back then, I could call on maybe 9 to 10 doctors' offices a day, and I may have a really good, meaty conversation with one or two. The other ones were shorter, maybe not as deep, but you had to be sensitive to what was happening in the doctor's office that day. So my background was in finance, believe it or not. So I know numbers, I know dollar signs, I understand the business side of healthcare, and I think that has helped me. So I started in sales. I then went into the inside world at Lilly at their mothership in their home office and worked on the marketing side and really gained an appreciation for the message that I'm sharing with a physician was developed by a team at our home office to align with the needs of that doctor. So I spent some time in marketing. And then while I was working in marketing, I learned I really love dollars and the finance side of things. We had a group called Health Economics or Health Outcomes. And those were scientists who tried to align what happens in healthcare to from a dollar perspective. So let's say a drug works really good in depression. So Prozac was the first product I sold when I was first in sales.
Right.
But if that product costs 10 times more than another product used for depression, you've got to have a pretty good value story on why they would want to use this one versus the less expensive one.
Right.
And the health economics people would look at all the different ways you treat a patient with depression. What happens when you successfully do it? What happens if you fail? And if failure means going to a hospital and spending 2 weeks in the hospital, there's costs associated with that. So the health economists are really looking at the costs associated with treating patients with different diseases. And I really love that because that was the combination of my economics or finance knowledge and my knowledge of healthcare from a physician, nurse, and healthcare practitioner's perspective. So I spent some time in our global health economics group and really appreciated the value of our products and how you develop that value with research. And so for the rest of my career, I have spent almost 20 years now in account management, where my job is to help business decision makers within the healthcare world decide which products they want to have available and used by their doctors.
Right.
And so it was sales, marketing, and then health economics. And then now it's been selling the value of our products to healthcare decision makers for the last 20 years in account management.
Yeah. Wow. It's just so, like, you never really would think of it as such a combination of so many different things. So what led you to this? I mean, was this something that you always thought you wanted to do, or was it like, I wanted to go into finance and then it's just kind of the path that has sent you down?
Yeah, it's kind of a funny story. My career path was, I loved numbers and I loved dollar signs, and that's why I majored in finance. And when I got out, I really love helping people too. And so I wanted to help people with money. And so I leaned towards personal financial planning and got my degree in finance with an emphasis on financial planning, which is sitting down with people like Brian and saying, okay, you want to retire at 55 or 57. You have $2 in the bank right now. That may not be possible, but let's talk about what it would take to get you to that point in time, how to invest your money, how to spend wisely, all that kind of stuff. So it was using information about investments and planning to help people financially and prepare for their future. I spent a couple of years in that world, and it was a challenge because there's a lot of gray area in the investment world. And I couldn't reconcile some of the things I was seeing happening with my ethics, shall we say. The tax code was a big wild playground for some people, but for me, it was pretty black and white.
Yeah.
So after about 3 years in the investment world, my brother-in-law told me about his job with Eli Lilly and said he thought I would be good in that role. And so I interviewed for a sales job out in California and got hired right away, again, with the knowledge base of I could learn, not because I had the best scientific grades in college, but they knew I could learn, and I had a good people and concern about people and what's important to them skill set ingrained in me.
Right.
So it took my desire to help people, and rather than do it financially, I was able to do it in healthcare and work with physicians and administrators on helping them make good decisions for their patients. And so it marries up my personal desire to help people and identify what's important to them with resources that I had available, being drugs or other information that could help people in healthcare.
Mm-hmm. Yeah, it's just weird how, so this isn't really something that you thought that you'd be doing at all. And it's crazy how you can go. Now, where did you go to college?
I went to Brigham Young University out in Utah.
Okay. Okay. So obviously, this is something that you've been in for a long time. You're very passionate about. What are some of the pros? And then obviously every job, no matter how much you love it, there are some things that you're like, I'm not real sure about that. What are some things that you see on that road?
Yep. The pros for me is it's a very well-paying job. I have never been able to complain about how much they pay me. They pay us well, and we work hard. It's not a 8 to 5 job. When I first started out in sales, it was probably 11 hours a day. Mm-hmm. I would leave the house at 7, sometimes 6:30 to go to a hospital and spend an hour in the hospital where doctors congregated back then, and then went out to their private practice. And I'd get home at 4 or 5 in the afternoon and then have dinner with my family and go back to work after the kids went to bed and work for another 2 hours getting ready for the next day. So we're paid well, but we work a lot and we work hard. I had one boss who said, don't work so hard, work smarter. And so you get better at doing it as time goes on. But so the pros are we're paid well. I have a chance to help people that help patients. Mm-hmm. And that's very rewarding. I've had family members who've been touched by cancer and seen the value of treatments that have changed their life for the better in the middle of a really bad situation. So I get to help those people see the value of our products versus something else. And hear the stories of, hey, I put my patient on this product and they responded and their life has been incredible since then. That's very rewarding to me on a personal level to know I help somebody with cancer or with depression or whatever it might have been over the years. It's challenging too. So every day is a little bit different. There's no, it's not the same all every single day. It's very different. So you may have 2 products today, and a year from now, you might have 4 that you're working with. You may be working in one disease state now, but you may be working in 2 or 3 different ones next year or even next month. So it's very dynamic, the nature of what we do. The cons are it's very dynamic. And so there's no consistency. There's no point in time where you can say, I got this locked and loaded. I can put it on cruise control. You're always having to learn new information, new customers, new data. And so you're having to keep on the edge of your seat every day, not knowing what's coming. The other con is, let's say I'm in a disease state or a tumor that all of a sudden our patent expires. And suddenly they don't need the 200 people across the country to promote that product in that tumor type or that disease state. So we'll repurpose 150 to something else that leaves 50 people out on the outside looking in. So there's constant what they call reallocation of resources, which basically means some of you aren't going to be here 2 months from now. Sharpen up your resume and get ready to go. And that's kind of how I left Lilly. We went through a couple of reallocations in a row. They did away with the whole division I was working with. And I couldn't find something I really liked, still left at Lilly. And so I left Lilly and went to work for Merck. And so the cons are that you just never know how long what you're doing is going to be valuable to your company in sales.
Right.
If you're in more of a line internal role where it's marketing or finance or accounting or HR, there's always going to be some consistency in those roles. But in sales, you're subject to what you're promoting today, and are you still promoting it next month?
Yeah.
So,
yeah. That's just all. Was it ABC? Is that always be closing?
Yeah. That's it. Yep.
So along that line, I mean, what kind of person would be good for this role, a personality, and what kind of person wouldn't be? Because I can be completely honest, I would not be good for that role because the ABC part, I hear no, and I'm like, okay, that's cool.
Yep. I would say a couple skills that I talked about already. One is you have to have a desire to want to help the people you're working with. Help them understand and appreciate the value of your product. Be sensitive enough to what's important to them to know how to mold your story around what's important to them. So you need to be a good listener, and you need to be compassionate enough about what you're trying to do with somebody else to listen to their side and what's important to them. So you have to have some good sensitivity to what's important to the people you're talking with. But you also need to be a good student in that you need to know how to learn what you need to learn to do your job. And I joked about my grades in high school and college in science. They were not my best grades, but yet I still did well enough to convince somebody that I could learn. And but if you don't like science at all, you could never do the job that we do. You have to know it and appreciate it enough to learn and do the job that we're asked to do. The people that wouldn't like this job, like you said, are people that can't handle rejection. They're going to struggle because that first job, when you're starting out in sales, it's 8 out of 10, 9 out of 10 calls in a day. You don't have a good conversation. And people are like, no, now's not a good time. Come back later. But I just drove, an hour to get here, and I have a message to give that's really, no, we don't want to hear from you today. So it's a lot of that. It's basically learning to fit into other people's schedule and needs, but you get better and better at justifying why you're there and what you want to share. So when they say no, like, look, I just need 20 seconds. That's all I need. Can you give me 20 seconds? So you learn to adapt to what they give you and what you have to say. And I used to tell my kids, the person who's good at my job, the one I'm in right now, they know who to talk to, what to say, and when to say it.
Yeah.
So you need to know who the decision makers are, and you have to be able to network within any organization to know, okay, who really makes the decision. You need to know the information your company provides you well enough to know what you're going to say when they give you a chance to say it. And then you also need to know, okay, when a decision's coming, how do I get in front of that person that's going to be involved in making the decision, whether it's an individual doctor or a nurse that influences the doctor, or it's a medical director who's making the decision for all of the IU Cancer Center, what they're going to do as far as this particular tumor type. So it's a lot of things, but the basic boils down to, can you communicate effectively? Are you sensitive enough to know what's important to the customer? And then knowing how and when to push your message when you really feel like you need to and you can, and it will be meaningful to the person you share with.
Yeah. It's just it's a lot of tightrope walking. It kind of seems like in the position. So now I can handle rejection. I'm just am good one time with it. Like, okay, yeah, I get that. It's fine with me. But, so what? How would someone prepare for this profession? Just any classes or anything like that?
I think some things that would have helped me. I served a mission for my church, and that really helped me learn how to handle rejection, but also how to communicate with people. You have to be able to look eyeball to eyeball with adults and have a meaningful conversation. So if I'm a high school student and I'm thinking about going into sales, I need to learn how to communicate eyeball to eyeball. I had a friend who say the biggest thing he hears about video games is it's great for hand-eye coordination. He says the only hand-eye coordination you need as an adult is to look somebody eyeball to eyeball and shake their hand like you mean it.
Yeah.
And I truly believe that's an important skill that you need to develop. Take a job in high school where you are looking face to face with a customer, and where every now and then you have a customer that's dissatisfied and you have to solve the problem. So problem solving, the ability to communicate eyeball to eyeball, and then just working hard in school so you can demonstrate you have the ability to learn. I think that's probably the most important thing, whether it's just to get into college, but then get a job out of school. Your GPA doesn't reflect what you know as much as it reflects you're willing to learn and adjust and adapt to what a teacher is asking you to learn to do well in their class. What you got on a history test in as a junior in high school isn't as important as the fact you learned how to study for that test, and you learned what the teacher wanted, and you were able to deliver on what that teacher wanted on the test. And that sounds crazy, but that's what the world is all about, is demonstrating you know enough of what the needs are of who you're working with, that you're going to learn it and deliver it and show that you've done what they've asked you to do.
Yeah.
And that applies to any job I think that you're going to be in.
Yeah, definitely. And I think, I think you kind of glossed over it pretty quickly, but your mission trip, or the being on the mission, I'm sure was a huge role in not only the fact that you probably experienced a lot of rejection, but you have, and not to get, for anyone watching this too churchy, but and life or death message that you may only have 15 to 20 seconds to deliver. And so that probably helped you out a lot too.
Exactly. And it's funny, the boss that hired me with Lily when I first started in sales hired 4 more return missionaries after me because he says, I like what you have in the skills you developed as a missionary. So yes, it's important in sales to be able to communicate effectively, eyeball to eyeball, have passion about the message that you have, but also be sensitive enough to listen to what they're thinking and feeling. And you learn a lot of that while you're in that type of a world as a missionary, or just even a 2-week mission in the summertime.
Yeah.
You learn to listen to people and be compassionate about their needs and helping try and meet their needs. And there's a lot to be said about that.
Yeah, absolutely. Okay, last question. Think back probably 10 years ago to when you were a senior in high school, and just general advice for high school students.
Yeah, I think today you don't have to go to college necessarily to be successful in life. I think you need to try and get a feel for what your skills are and what you really like to do, what your interests are. I'm a big believer in the strong interest inventory to see what I'm really good at or what I'm passionate about or what I like to do, and trying to align your career with those things. Mine told me teacher or preacher, believe it or not. Those were the 2 that it narrowed it down to. And in the job I'm in, I do both.
Yeah.
Right? I am teaching a message about a product, but I'm also preaching a theory that says we have to help the patient, and this is how we're going to do it together. Let's work towards doing and accomplishing that goal. And you have to be passionate about what you do so that you can overcome the challenges that are going to come. So if it's okay to say college isn't going to lead me to what I want to do because my interests are in this direction, but I think you do need to recognize that if you don't have a skill set or an interest and you go into something because somebody else said it'd be a great career, it probably is going to be a bit of a struggle.
Yeah.
So my advice is find out what interests you and what careers are associated with those interests, and then figure out what's the best next step for me out of high school. Is it college? I would say probably 80-75% of those careers that are out there probably do require college to a certain degree. But man, if you're really good with your hands and you really like building houses, man, the world needs people who are skilled at building houses. And there's nothing wrong with that. There's a lot of people with great careers, but it's really trying to understand what you are good at, what you really enjoy doing, and then finding out what path is going to get you there from a next educational perspective. But I would encourage everybody to find out what they really enjoy and like to do by taking some of those interest inventories, and also exploring lots of different majors. I thought I was going to be a business major with an MBA because that's what was on the cover of Newsweek and Time magazine in 1981 when I was a senior. I as a missionary thought, I saw an ad blow by me on the street that was a Nike or an Adidas ad in Spanish where I served in Argentina. I thought, international business would be pretty cool. I could use my business skills and my Spanish language skills. But then when I got back to college, I realized I still am passionate about numbers and about helping people. And so that's kind of why I went the direction I went with personal financial planning. And I'm not doing that and haven't done that for 30 years, but it set me up for demonstrating I could learn and help me learn what was really most important to me. So
yeah, absolutely. So those are all great points, and we have those Naviance. So for all the high school kids watching that, make sure they get on Naviance and take those inventories. So once again, Robert Baldridge, the Director of Strategic Accounts for Merck Pharmaceutical, thank you so much for joining us and taking the time out of your day to speak with our kids.
Oh, it's my pleasure. I wish them all the best. Thank you.
Thank you.
All right. Take care, Ryan.